Hey, it's Dr. Noah, Back to Chiropractic, making a quick video about the non-surgical spinal decompression unit, which is a therapy I offer here at my practice, and it's widely used as an adjunct to chiropractic care to take care of people's backs and also help prevent injuries and also help decrease the amount of back pain, and I'll tell you why. So first of all, it's called non-surgical spinal decompression, and what it is that you lie on this machine and it applies a decompression type force to either your low back or your neck. Okay, so I have a picture here. It's very gentle. There's parameters and there's certain settings that I put in based on certain things like your body, your height, your weight, your sex, things like that. So it's very comfortable and it's tailored directly to you and for what you have going on. Okay, I have a couple stats here. Number one is they did a study where they did MRI imaging of disc herniations in people's low backs, and what they found was that people that used non-surgical spinal decompression to get better or to heal from a herniation, a low back disc herniation, actually saw that they had 27% faster regression of not only the actual size of the herniation, but they also got better faster and saw symptoms resolve a lot quicker. Now, a study just came out of Korea that said that about 81% of adults have some type of low back or spinal herniation going on in their body, whether or not they're symptomatic or asymptomatic. So it tells you that really, regardless of who you are, spinal decompression can be a benefit or a beneficial therapy for you in terms of trying to avoid future issues. Even if they're minor right now, they could flare up into something more severe later. Here, I got my spinal model, and in between each level, there's all these discs here, okay? And obviously gravity pushes down and these discs get squished, okay? So what that machine does is that it applies a nice light traction and starts to take the pressure off the disc, which then again also will stretch out the musculature and open up the hole where the nerve is coming out, right? Which is the goal of the chiropractic adjustment. So that's why it's the best possible adjunct therapy to chiropractic care. Lastly, here's a good, healthy spinal model. You can see that there's a big opening for the nerve. And we all know that as people get older, they typically get shorter, right? And so this is what a more degenerative spine would look like, where you can see that there's less disc space here, which then of course causes more overlap in the joint, which is likely to cause more osteoarthritis, build up pressure, tension, pain in that joint, but then also a decrease in the amount of actual space where the nerve is coming out, meaning that there's pressure on the nerve. Here on this side, you can see that there's a herniation here and there's neural involvement. It's actually putting pressure on the nerve. So if this was occurring in your back, you'd definitely be feeling pain. So again, if you have any questions about non-surgical spinal decompression and how to use it in combination with chiropractic care, feel free to give me a call at Back to Chiropractic.